In ski racing, injuries are a rite of passage. It is not a question of if, but rather a question of when. And when happens, no one knows more about skiing-related injuries than the legendary Dr. Richard Steadman. As a practicing orthopedic surgeon for over 35 years, Dr. Steadman's patient list is a veritable who's who of sport, including Kobe Bryant, John Elway, Mario Lemieux, Martina Navratilova, and Ronaldo, to name just a few. But it is the frequency and severity of skiing injuries that has allowed Dr. Steadman to pioneer new techniques and strategies that have dramatically changed the impact of injuries.
Proportionately, there are a lot more people injured in skiing, and I think it's just the fact that you have it's almost a perfect storm. I think the downhill injuries were bad 25 years ago, and they're bad now. You may be a little more susceptible, I think, with the side cuts and just basically the make of the ski makes you a little more susceptible to a slightly more severe injury. The terrain is a factor too. The best downhill is the hardest downhill. So I think that puts people at risk as well. I never did a procedure until I was convinced it was the right thing. In other words, I never just experimented. I would kind of come up with an idea and think it through and start to work in stages on that idea. So I think the fact that I was dealing with skiers made me realize that even more, because you can't cheat it. There's only one way to get on edge, and that's to use your ankle and actually use your knee as well. So I started in the late 70s and early 80s to have the theory that we had to get not just the ligaments fixed or the bones fixed, but the whole joint fixed. And getting the whole joint back to having full mobility was what made the people come back and win a lot of medals.
In the 2001 World Championships, U.S. ski team member Bode Miller caught an edge and careened into the fence at 80 miles per hour, completely tearing the ACL in his left knee. Consistent with his nonconformist approach to the sport, Bode eschewed conventional treatment and instead leaned heavily on some unorthodox advice from Dr. Steadman.
It was an unconventional approach that I took with Bode, but I thought it was the only chance we had to make him come back. It was unconventional in ski racing at the time. It's more conventional now than it was then. Basically, we did a procedure that made the ligament heal. So we sewed the meniscus cartilage back and then came back, and we tried to make the ligament heal and came back at 3 weeks and looked at it, and it was healing. And then we looked again at 6 weeks, and it was healing. So we left that without doing a full reconstruction. And because of the circumstances around his knee, I just don't think he could possibly have achieved what he's done if we'd gone a conventional route. It was a little bit of a hard decision, and there were a lot of people that questioned it at the time, but I think the results speak for themselves.
The following year, Bode won 2 silver medals at the 2002 Winter Olympics, and within 4 years, he collected 5 World Championship medals and became the first American male in over 20 years to win the overall World Cup points title. This level of achievement, after such a severe injury, provides an excellent illustration of how perseverance and toughness are mandatory attributes to success in downhill racing.